cardiology you want. Cardiology it is. After administering nitroglycerin to After administering nitroglycerin to a patient with chest discomfort, it is most important for you to is it A, ask the patient if the discomfort has improved. Is it B, find out how long the discomfort has been present? Is it C, position the patient supine and transport immediately? Is it D, reassess the patient's blood pressure in 5 minutes?
B.
He says B.
D.
You said D?
Yep.
D. Good. One thing we know about nitroglycerin is a vasodilator, so it drops the blood pressure. And before giving it, the blood pressure has to be at least what systolic? Top number. Before giving nitroglycerin, the top number, the blood pressure got to be at minimum what number? He says 90. The answer is no. It's 100.
100.
If it's less than 100 systolic, we can't get it.
Right. Okay. Right. So you're right.
All right. When assessing a patient who has stroke-like symptoms, you should recall that is it A, the majority of strokes are caused by a ruptured cerebral artery. Is it B, the patient may be unable to communicate but can't
Medic
understand?
8660. Sick person.
Right side
700
weakness
Chase
indicates
Street.
the stroke
Sick
in the
person.
right cerebral
Medic
hemisphere.
8660.
Or is
Sick
it B,
person. 700
fibrin
Chase Street.
therapy
Timeout
given within 6 hours
1324
following the
hours.
stroke?
Sick person.
When assessing a patient who has stroke-like symptoms, you should recall that it says C, right side weakness indicates right side cerebral hemisphere. Survey says right side weakness indicates left side cerebral hemisphere. Left side brain control right side body. Right side brain control left side the body. The majority of strokes, which is A, the majority of strokes are caused by clot. Ischemic strokes are 80%. Hemorrhagic strokes, which are the ruptured artery, are 20% of the strokes. And then D, it should be 2 hours, 4 to 5, but not no 6. But you should recall that a patient, just because they can't speak, they can definitely understand what you're saying sometimes. So be mindful. The most important treatment for a patient whose cardiac arrest was witnessed is
High quality CPR.
he says high quality CPR. Can't ever go wrong with picking that question, right?
Absolutely not.
Good. Options was A, defibrillation, B, cardiac drug therapy, C, rapid transport, D, high quality CPR, and the answer was D, high quality CPR. Aspirin is beneficial to patients experiencing an acute coronary syndrome because it A, prevents a clot from getting larger. Is it B, effectively relieves their chest pain? Is it C, decrease the workload by lowering BP? Is it D, destroys the clot that is blocking the coronary artery?
Prevents the clot from getting bigger.
He picks A.
Aspirin.
Good. Aspirin is an antiplatelet. Acute coronary syndrome, that's either angina, which is chest pain that can be relieved by nitro or rest, or a heart attack, which is acute myocardial infarction. Aspirin job is
Which one was angina?
angina. It's just I'm just telling you.
Okay.
Acute coronary syndrome.
Okay.
That
Okay.
consists of 2 things.
Right.
Only 2 things. One is angina,
Mhm.
which is chest pain, that can be relieved by nitroglycerin
Right.
or relieved by rest. Stop doing what you
Right.
was doing when chest pain occurred.
Right.
And if the chest pain is consistent, then more likely it's acute myocardial infarction,
Mhm.
a heart attack, which is the other acute coronary syndrome.
Yeah.
B, it says effectively relieve their chest pain. That's what nitroglycerin does
Mhm.
for angina.
Okay.
C, decrease the workload by lowering the BP. That's what nitroglycerin does.
Increases cardiac workload.
Yeah, that's why the BP gets low.
Okay.
And then C, destroy the clot that is blocking the coronary artery. No. All right, we got a 50-year-old man. His implanted defibrillator has fired twice within the last hour. He is conscious and alert and reports a sore chest. Further assessment reveals that his chest pain is reproducible to palpation and is also localized to the area of his implanted defibrillator. Treatment for him should include: is it A, apply the AED and transport? Is it B, prompt transport with continuous monitoring en route? Is it C, deactivate his defibrillator by running a magnet over it? Or is it D, give up to 3 doses of nitro and wrap transport? 50-year-old man, defibrillator went off twice. He now has a sore chest. It hurts when you touch it, right in the area where the defibrillator is.
B, prompt transport with continuous monitoring.
Good. Prompt transport, continuous monitoring. We're not going to apply the AED. Word of advice: you don't put the AED pass on nobody who has a pulse, who's breathing and has a pulse. C, deactivating the defibrillator. We do not do that in the field. D, however, it says give up 3 doses of nitro. If he'd had chest pain, we would have done that. But we know that his chest pain is from that misfiring of his defibrillator, because it says when you touch his chest cavity, which is the wall of the chest, it's producing the pain. So that's not cardiac, that's more muscular. All right, which of the following is an abnormal finding when using the Cincinnati Stroke Scale to assess a patient who presents with signs of a stroke? Is it A, one arm drift down compared with the other side? Is it B, one of the pupils is dilated and does not react to light? Is it C, the patient's face is symmetrical when he or she smiles? Or is it D, both arms drift slowly and equally down the patient's side? Good question.
I want to say A, but I'm going to go with D.
He wanted to say A, but he's rolling with D.
Yeah.
Cincinnati Stroke Scale, that's our FAST exam, F-A-S-T.
See how
What does
it
the
goes.
F stand for?
The F is for
Facial drooping.
facial drooping.
Facial drooping, they're having a stroke. What does the A stand for? It's arm drift. Arm drift, you had them hold their hands out, close their eyes. If one arm began to drift, positive they're having a stroke. What does the S stand for? It is slurred speech. If the speech is slurred, positive they're having a stroke. And T, the most important factor in the FAST exam, stands for time. That's important. When was the last time this patient was seen normal? So the Cincinnati Stroke Scale, that's our FAST exam. F-A-S-T. F, facial droop, they're having a stroke. A, arm droop, they're having a stroke. S, slurred speech, they're having a stroke. T, the most important factor, time. If they hit any one of those,
You don't mind.
it's a stroke.
What was that again? It was
F, facial droop. A, arm droop. S, slurred speech. T is for time. When was the last time the patient was seen normal? Which is the most important factor in that FAST exam. And that is our Cincinnati pre-hospital stroke scale. Alright. Prior to being reoxygenated in the lungs. Good question. Prior to being reoxygenated in the lungs, blood passes through the. Prior to being reoxygenated in the lungs, blood passes through the. So it's saying prior, meaning before being reoxygenated in the lungs. So before going to the lungs, which set of valves do the blood pass through? You have to roll with B.
B.
And D? B.
Dog.
All right, let me see. Is it A, mitral and tricuspid valves? Is it B, aortic and tricuspid valves? Is it C, aortic and pulmonic valves? Or is it D, tricuspid and pulmonic valves? And you say what?
B.
He says D is dog, tricuspid and pulmonic valves. And why not? Let's just roll through it. Heartbeat, because I need oxygen, so my heart beat, boom, boom. Blood goes from the inferior vena cava, from the lower part of my body, the superior vena cava, from the top part of my body, to what part of the heart? The right atrium. Heart beats, boom, boom. Blood goes from the right atrium to the right ventricle. But to get there, it goes through the tricuspid valve. It goes from the right atrium through the tricuspid valve to the right ventricle. Those valves keep the blood from backflowing. Heart beats again, boom, boom. Blood goes from the right ventricle to the pulmonic valves. So it can go to the pulmonary artery, the only artery in the body without oxygen. Heart beats again, boom, boom. It's in the lungs. Getting that good old fresh O2. Heart beats again, boom, boom. From the lungs, the first stop is where?
From the lung?
Yeah.
To the aortic.
To the left atrium.
Oh, left.
Now it's at the left side of the heart. The side of the heart gets oxygenated. Heart beats again, boom, boom. It goes from the left atrium to the left ventricle, but it goes through the mitral valve, also called the bicuspid valve. It can be mitral or bicuspid. They use them interchangeably. Left atrium to the bicuspid / mitral valve to the left ventricle, the largest part of the heart, the hardest working part of the heart.
Which part?
The left ventricle.
Left ventricle.
It's your largest part of your part, and it's the hardest working part of the heart, the left ventricle. The blood leaves the left ventricle, it goes through the aortic valve to the aorta,
Right.
from the aorta to the body.
Yes, I'm still working on it. I gotta tighten up with that though. But better than no.
Well, you got 20 minutes, but you get it.
Yeah.
Tough, right?
Oh, yeah.
Shortly after assisting a 60-year-old woman with her second nitroglycerin treatment, she tells you that she is lightheaded and feels as if she's going to faint. Her symptoms are most likely due to: is it A, low blood pressure? Is it B, an irregular heartbeat? Is it C, nervousness and anxiety? Or is it D, a drop in her blood sugar?
Second, nitroglycerin. Go with A, low blood pressure.
It's like common sense to you now, right?
Facts.
She's on her second nitroglycerin. Obviously, her blood pressure dropped. The
Right.
first one it dropped some. The second one it most definitely dropped more.
Exactly.
Nitroglycerin is a vasodilator. Dilate the vessels. If the vessels dilated, blood pressure drops. Which of the following is the most detrimental effect that tachycardia can have on a patient experiencing a cardiac problem? Good question. Which of the following is the most detrimental effect that tachycardia can have on a patient experiencing a cardiac problem? Is it A, increased blood pressure? Is it B, increased oxygen demand? Is it C, increased stress and anxiety? Or is it D, decreased cardiac function? Detrimental, bad, can have the worst, the most bad, which can have the most detrimental.
Increased cardiac function.
A, increased blood pressure. B, increased oxygen demand. C, increased stress and anxiety. D, decreased cardiac function. He says tachycardia can cause a decrease in cardiac functioning. Survey says, nope. If the heart is already bad
First thoughts.
and the heart is speeding up more, You're demanding more oxygen from a bad heart. That's bad. You're causing more stress on a bad heart. It's like the epinephrine question you had.
Hell, I gotta follow my first line.
Like last week when you asked about epinephrine.
Yeah.
And I told you individuals with heart disease,
Can't get it.
no, they can get it, but they may have a problem.
Oh, yeah,
because
like
the
that.
epinephrine's going to do what to the heartbeat?
It's gonna work it harder.
It's going to speed it up, work
Speed
it
it up.
harder. It's already a
Right.
bad
Okay.
heart.
Okay. And you know, and I was looking at B first. Damn. I really gotta follow my first line.
Aspirin. Aspirin may be contraindicated in patients with is it A, glaucoma, B, diabetes, C, stomach ulcers, or D, ibuprofen allergy.
Stomach ulcers.
Good, stomach ulcers because aspirin
Oh,
are
right.
antiplatelets. They stop clotting. So a stomach ulcer, you begin to bleed, you're gonna bleed out. You're not gonna be able to clot. Yeah, bro. What subject going next?
Was that cardiology?
That was cardiology.